Lavan, can you one more time? Can you please check if you can hear my voice so I can
I
get started?
I hear you
Okay.
fine.
Okay. All right. Thank you. Good afternoon, everyone. First, on behalf of the Commission, I would like to welcome you all and thank everyone for attending today. It is my pleasure to host this webinar with you to discuss about 2021 Medical Care Database Data Submission Manual updates. We will begin by a quick roll call. I'll start by introducing myself. I am Shankar Mehta. I am Chief of Cost and Quality at Center of Analysis and Information System. Uh, Folks from MHCC, Ken, if you are on the call, could you please start by introducing yourself?
Hi, this is Debola Akiyemi, Program Manager with MHCC.
Thanks, Debola. Do we have Ozzy or Gemini or Ken from MHCC team?
Hi, this is Gemini Shah. I am a Webmaster Supervisor at MSCC.
Hi, Gemini. Okay, I'm not able to see the participants on my screen, maybe because I'm sharing the screen or something. So I don't know who is there and who is not. Okay, now I think I know. Um, okay, I don't see Ken joining the call at, so we'll wait for him. Meanwhile, folks from DLH SSS, could you please introduce yourself?
Hello. Hi, everyone. Oh, go ahead. Go ahead, Shravani. I'm sorry.
Lydia, go ahead. Sorry.
Oh, hi. I'm Lydia Rogers, and I am the new project director for this project. And I'm going to hand it over to the project team that'll be working with you today.
Thank you, Lydia. Hi, everyone. I'm Shravani Malila, and I am the program analyst at DLH. My primary responsibility is to provide support to the payer submissions and the overall payer support activities.
Thanks, Shravani. Thanks, Lydia.
And I'm Joey Franklin. I'm a data analyst for DLH, and I work on the data support team for this project for MHCC.
Great. Thanks, Joe. Okay, we'll get started. Okay, so as shown on the agenda and the agenda that we shared with you a couple of weeks back, we'll be mainly talking today to you about the improvements in data submission that we accomplished in 2020. After that, we will share about use cases to reinforce why we need this data, followed by 2021 deadlines. Hello? Okay. Then we will discuss about latest changes to 2021 MCDB data submission. After that, Ken will talk about the renewed focus on certain data types starting in 2021 and beyond. At the end, we will talk about few frequently asked questions. And so some of you might be familiar with some of the information that is being shared. So please bear with us until we get over first few slides. It is important that we go over these initial slides every year for the benefit of the newcomers. And we want this to be an interactive presentation. So please stop us if you have any questions. All right. MHCC mission is to plan for health system needs, promote informed decision making, increase accountability, and improve access in a rapidly changing healthcare environment. By providing timely and accurate information on availability, cost, and quality of services to policymakers, purchasers, providers, and the public. The Commission's vision for Maryland is to ensure that informed consumers hold the healthcare system accountable and have access to affordable and appropriate healthcare services through programs that serve as models for the nation. To accomplish this mission and vision, it is critical to maintain a robust medical care database. We would like to share the progress that we have made in 2020 compared to 2019. For this comparison, we used data from third quarter of 2019 and 2020 as of January 4th of 2021. Overall, reporting entities were compliant with submitting the third quarter of 2020 data before the deadline of November 30th of 2020. For the
Excuse me, Shankar, were you meaning to have a presentation sharing? Because I'm not seeing it, and I checked with some internal colleagues at United, and we are not seeing a presentation.
Oh, I'm so sorry,
That's
Bernie.
okay. I'm sorry to interrupt you. I just
No worries. I
thought if
thought
you didn't know.
yeah, I thought yeah, I shared the screen and maybe there was some hiccup
Perfect.
on the
Now we're
Zoom.
good. Yep. Now
Okay.
we're good.
Thank you
Thank
so
you.
much for calling out. Okay. Appreciate it. Okay. All right. Okay. So I'll just repeat this slide so that for benefit of everyone. So as we can see on this slide, for this comparison, we use the data of the third quarter of 2019 and 2020 as of January 4th of 2021. Overall, reporting entities were compliant with submitting third quarter of 2020 data before the deadline of November 30th of 2020. For the third quarter, we expected a total number of 35 payers to submit the data. 80% of payers passed the data validation checks performed by DLH, and 17% of payers are under status of under review. These percentages are similar to the third quarter from 2019. This consistent improvement in data submissions are due to improving collaborative partnerships between payers, MSCC, and DLH staff. So why does the Commission collect this data? As Maryland moves to adopt some very ambitious healthcare delivery reform initiatives, it is important to maintain consumer engagement. One of the strategic priorities of the Commission is to make Maryland Healthcare Commission the trusted source for quality and cost information. Next, we will look at some of the important price transparency initiatives undertaken by the Commission by using the MCDB data. MCDB data is used to support price transparency initiatives such as Where the Cost website, which is designed to increase transparency of cost and quality information to consumers about certain procedures to aid in making healthcare decisions. By providing this public information on prices for common medical procedures, MHCC will enable Maryland citizens to match the prices with provider performance. This is integral to our mission. MCDB data is also being used to support other initiatives such as provider price compare, prescription drug pricing, and reducing low value care. MHCC collaborates with a variety of partners to increase the value of the MCDB in statewide efforts to support the state healthcare policy improvements. Three big partners are Health Service Cost Review Commission, with whom MHCC collaborates to support total cost of care model as Maryland moves to adopt some very ambitious delivery reform initiatives. Second is the Maryland Insurance Administration to perform rate review of covered evaluation and management services. Third is the Maryland Health Benefit Exchange to support their initiative to maintain the out-of-pocket cost calculator for individual market enrollees. MHCC is mandated to report annually about state healthcare expenditures. To meet this requirement, we create privately insured report. Privately insured report is created on annual basis to provide information about spending and use among Maryland privately insured population with less than 65 years of age. It reports on variation by market segment, region, age group, and service category. Professional service report. Federal healthcare reforms leverage payments to providers to create incentives for providing more efficient and less costly care to consumers. Professional service report examines the variations in payment rates for professional service among private healthcare insurance carriers and benchmark these payments to Medicare and Medicaid payment rates for the same services. It also reports on trends in the service volume and level of payments for healthcare services provided by physicians and other professionals to privately insured non-elderly residents of Maryland. Third, ad hoc requests. These are done on ad hoc basis. For example, early last year, Commission provided a report on prostate cancer screening out-of-pocket member cost to support House Bill 852, whose purpose was to prohibit cost sharing for prostate cancer screening services. Now I will turn over to DLH team to share the next part of the agenda. Over to you, Joe.
Thank you, Shankar. Can you hear me?
Yes.
All right, great. I'll begin talking about the 2021 MCDB deadlines. So this is the schedule for the 2021 medical care database submission schedule. Please pay particular attention to the final data submission due dates for Q1. That is going to be May 31st, 2021. For Q2, that is August 31st, 2021. For Q3, that is November 30th, 2021. And for Q4, that is February 22nd, 2022. And please also note that the deadline for the annual file waiver requests is due tomorrow, January 15th. And now going on to the submitted data. It is considered final, and final data means that the payers must report clean data to the MCDB portal on or before the final data submission due date. Clean data means that the data has passed all of the Tier 1, Tier 2, and Tier 3 validation checks performed by DLH. Data is considered late if submissions have not cleared all validation checks by the final submission date or approved extension date. So this means that if the Tier 2 data element validation report, for example, is still showing errors, the submission is considered late. If reporting entities need an extension, the reporting entities must request a waiver on the MCDB portal on or before the extension request deadline for each reporting quarter. And please note that MHCC has the right to fine the entity up to $1,000 per day per report. Next, I'll begin discussing the changes to the 2021 MCDB data submissions. First up, we have the changes to the claim files, which includes the professional, pharmacy, institutional, and dental services files. The first change is for the professional services file only, and it is for the units of service field. the length has been increased from 3 to 5 to match the length of the institutional services file. The second change that we have is we have added a field called claim received date, and this is the date that the claim was received by the payer. Third, we have added the network administrative and access fees field. And this is the liable amount paid by an insurer for the administration of its members' claims and access to out-of-area provider networks, also known as out-of-network providers. And Ken, would you like to further explain the network administration and access fees? Or Shankar, would you? I'm not sure if Ken is still here.
Ken, if you're speaking, you're on mute. We cannot hear you.
Isabella?
We can continue forward because I know we further explain it in the FAQs.
Sure.
All right, so next we have the changes to the eligibility file. We have added an ERISA indicator field, and this is to indicate whether or not ERISA reporting applies. So whenever you submit this field, you will use 00 for not applicable, 01 for non-ERISA, 02 for ERISA opt-in APCD, and 03 for ERISA opt-out. And then I'd like to hand it back over to the MHCC team to go over some other items for 2021.
Yeah, this item will be covered by Ken. It seems like he is having some technical issues to join the call, and I cannot make out from my side if he has joined the call or not. Lawan or maybe somebody from MHCC, could you please check if you see Ken is on the call or not?
Yeah. Do not see him on the call. Did you just hear me?
Yes,
Yes.
Lawan, thank you. Yeah, I heard you. All right,
Yeah.
so
You can go ahead. I do not see him on the call right now.
okay. All right. So beginning in, I will take it on and cover this one. That's fine. So there are some few special instances starting this year and beyond that we wanted to bring to your attention and share this with you. And so we wanted to talk to you about the federal health employee benefit data. As you might or some already be aware, already know that due to the special OPM ruling, there was a decision that was made for payers not to submit the federally health benefit data to MCDB beginning in 2018 and 2019 onwards. And because of that, there is kind of the data leakage that is there in MCDB, which means that MCDB does not have data for all the different payers and market types. Similarly with ERISA data, so starting on 2016 onwards, due to GOBEL ruling, we could not get this data in MCDB. And the third item is the race and ethnicity data. As we are all going through this pandemic, and we see that there is a lot of request from policymakers and researchers to have the race and ethnicity data available in the MCDB, which will enable them to make certain reports that can shed some light on some of the cost and utilization related reports and look at those reports from the angle of race and ethnicity data. Right now, we have few payers who are already submitting this information to the MCDB, and starting from the year, we will be reaching out to the payers to request them to see how we can collaborate to get this data in MCDB, and sometimes early this quarter, or maybe sometimes later, we will be sending out a request for some of the payer representatives to participate in the initial brainstorming sessions to understand what are some of the challenges you might have from your side in terms of collecting this data, and if there are ways for commission to support you in any way so that we can get this data. And the fourth item is for the alternate payment method, which is we want to engage with you to see if we can get this data, and based on some of the inputs that we have received from other APCD states, we have learned that uh, this data is generated once a year, and it is so we will have to discuss with the group to find out when will be the right time to get this information, and how we can get this data.
Uh,
And
uh, I'm Shankar, I could help you out here to discuss more. Sorry, everyone. Sorry to interrupt.
sure, no problem, Ken.
Yeah.
Thank you for joining. Thank you.
Oh, sorry about that. So I just want to support Shankar, who have done a very good job so far. So the alternative payment method, it has been in a test mode from since 2014 in the data submission manual, and due to the very popular value-based payments that it seems as all payment methods are moving to in maybe in the next 5 to 10 years, we want to take this off of the test mode and have payers engage in providing this information. However, we would not just drop this on payers to report now. We are going to go through a deliberate process where we would meet informally with payers to find out a promising approach. I mean, based on what payers have in the organization, as Shankar said previously, that this information is collected at the end of the year, and that is true. I used to work on this information, and some of the reason why it is collected at the end of the year is there where all insurance companies have these what we call manual entries at the end of the year for where they close their annual statements, their books. So, but we are going to meet in the near future to meet with payers formally to find out a approach which is popular to them, and then we will make a decision as to what the format is going to be. We are going to take this back internally and discuss it with a few interested commissioners to have their input as well, and from there we'll come up with a format and instructions, then present it again to payers to discuss with each of you to have your buy-in, and then based on that we are going to finalize those instructions and format, and then have the data collection start. So so that is the kind of timeline that we are going to move forward with. We are not going to require you to report on this like immediately. We just want to give you time and give us time so that we could collaborate with you, because we want you to be at the table to actually decide and help us get this information. Also the more timely reporting. There has been a lot of demand and communication as far as our more timely reporting is concerned, as Shankar said during this report, that we are depending on this information, you know, to satisfy our strategic priority to make MSCC the trusted source for cost and quality information to the public, to stakeholders, and government collaborators. So your more timely reporting, it is very important, as the information that we collect is not for ourselves, but to benefit the people in Maryland so that they could make informed business decision, so to actually for the health insurance to their families, and also to our government partners like HSCSC in the total cost of care, and also the MIA in the rate review process, and the Maryland Health Benefit Exchange in the out-of-pocket calculator. So we are depending on you. We value the effort that you you do in providing this information to MSCC, and we see you not as just data submitters, but we see you as partners, as collaborators. So that's why with this alternative payment, we really want you to start with you at the table, in, you know, upstream, to really have your buy-in, to have your ideas. You know, we want to really have this information in a partnership with you, as we value your input. Also, I don't want to repeat what Shankar said with the FEP. You know, as we got the rug pulled out from under us in 2019, where the Department of OPM had said that they are stopping the reporting of the FEP data to APCDs. You know, they did not say why at the time, but currently we are engaging with OPM to really lift that that contingency, so that we could get that reporting back in our APCD. As you know, that data is population is pretty vast. It's about 22% of our private data in the APCD, and it's very important for us to really get that information, as we need it, you know, to support our total cost of care project we have with our sister HSCSC. With the ERISA data, we continue to encourage payers to report voluntarily. You know, we encourage payers to provide opt-in, opt-out approach, where they should invite their large employers, give them opportunity to report voluntary to the APCD. That ERISA data is about a third of our private data, and given this pandemic, you know, the reporting of all data, you know, in the state of Maryland is really important. So I think we welcome that volunteer submission from employers, you know, so that if payers could encourage, give the self-insured ERISA employers the opportunity to opt in or opt out in reporting to the APCD. And that's all I have to say for this slide. Thank you.
Back to you, Joe.
All right, now we will move on to the frequently asked questions. The first question is, what are network administrative and access fees? The network administrative and access fees are for out-of-network providers when members of the home insurance plan receive care while traveling out of state by a host insurance plan. The host insurance plan will charge the home plan a fee to administer the member's claims and another charge for accessing the host plan's network to receive the care. These fees will have the same incurred date and claim number for the insured member service received out of state. This information is reported to the MIA by some payers as part of a claim if applicable. Now, upon your research in your organization, if you find out that you do not have the information on the network administrative and access fees, then it is acceptable to leave the field blank. The next question is how to encrypt patient/enrollee identifiers, internal subscriber numbers, and contract number fields. Payers can follow any encryption algorithm of your choice. Some examples of these encryption algorithms are AES, RSA, RC6, or a custom homegrown algorithm. Once selected, though, it is imperative that you keep the same algorithm or the encryption key for future submissions. We have also provided a link on how to implement AES encryption in PHP and Java programming language. And the last question that we have is, I had requested a column length or threshold waiver back in January and it hasn't been approved yet. Now, as per MHC's instructions, DLH recommends column length, threshold, and certain other waivers for approval only after the initial data submission by the payer. This is to ensure that the waivers are applicable to the data being submitted to each payer or by each payer. And now we will open up the floor for payer questions and discussion. Does anybody have any questions?
Yeah, as Joe, I would like to jump in here. As I mentioned in the beginning, some of the information might be very familiar to most of the peer representatives here, having gone through this more than once. And seems like most of this has been either clarified or discussed previously, either during similar training sessions or maybe during as one-off emails between DLH staff and the peer representatives whenever they had some kind of uh, issue or kind of something which is not clear. They would send email or and we get on a call to understand that and clarify that. So I think because of the knowledge share and information sharing at that level, it looks like you might not have any questions, but we'll always welcome your comments and any things that we can do better to continue our partnership and continue with this good progress that we have been making in past few years in getting the data on time. And as Ken mentioned, it is very important for us to get this data on time, as this timely submission is dependent on some of the high profile initiatives that the state has undertaken. So with that, I think we have covered everything on the list in the agenda. And again, we sincerely want to thank you all for taking time out of your busy schedules to attend this webinar. We hope you found it was informative and there's something that you can walk away with. And if anyone for any reason has any questions about anything which we could not discuss today, please feel free to send us an email or contact us for if you have any questions regarding the policies or anything with things like that. my email is here, and it's also in the data submission manual. So we are always happy to help and provide any information that you might need. And if it is any technical or data processing, the point of contact from DLH side is Shravani. With that, I would like to end this call. And Ken, would you like to have some finishing notes?
Sure. So thank you very much for attending today. As Shankar said, that some of you may be shy to have questions today, but please go back and share it with your organization. You might have questions later on things that was said. You might reread this information, something that you might not understand. But is it important for you to contact us? If you need another call with us, we will be happy to meet with you. But because the data that you support to the MCDB is really important, and as I said before, we are depending on you as the starting point. All of these use cases that Shankar had talked about in this presentation, they're all downstream events, but they cannot happen if the information that we receive initially is not correct. So we are depending on you as not as just people or organizations who just submit data to the MCDB, but as partners and collaborators. We want to work with you. Submitting the information in a timely manner is very important. And also as accurate as possible. So meet with your organization, meet with your actuarial department, to make sure that what you are submitting and what your actuarial department are submitting to the MIA, you guys should be talking to make sure that you guys are on the same page. But we realize that submitting data to the MCDB, it's a daunting task. And we are working with you as partners and collaborators to really make this happen accurately. We thank you for all your help and all your contribution.
Thanks so much, Ken. I think that's it for now. Once again, thank you and enjoy your rest of the day. Thank you, everyone, for joining the call.
Thanks, Shankar.
Thank you.
Thank you.
Thank you.